Hey there, Ginger Bratzel from New Patient Traction Automation, and each week we bring you a short tip, strategy, big picture thinking, or mindset to get to the next level in your dental practice, because we want your life to be easier, not more complicated, and we want you to be able to get where you want to go so you can serve more patients and be more effective. And so we're talking about case acceptance, treatment plan acceptance, case conversion. Those are all synonymous terms, and making it happen. And if you are a follower of ours, and depending on when you see this, we're going to be doing a masterclass training on this topic about getting your team on the bus to increasing your treatment plan acceptance, and motivating them to take the drama out of this to get your results. And so I have another lesson in strategy today, and it's really a case study, and it's from my personal experience. So recently I had to see a doctor for something they thought was suspicious, so that it turned out not to be suspicious. But as I'm first meeting with this doctor, and it's just like what you would go in for your patients, and he was talking to me the next step, the next strategy, just like we're trying to help our patients in doing it. When we're presenting what they need and how we can fix it, the case acceptance, that treatment planning starts way before they sit in that chair and you're talking to them for the first time. And during this masterclass training that's going to be coming up, depending on when you watch this, it might have already happened, so hopefully you haven't missed it. Making this big picture happen. So he explained what the situation is, what he was concerned about, what he wasn't concerned about. And he gave me a handout. Now, we rely on pamphlets and brochures way too often. They are usually way too complicated, and you start the dental ease. You go into a dental school lesson with them, and it really shuts people down, because if they wanted to be a dentist and learn all that, they would be a dentist. So don't think you have to educate them and train them on everything. And so this is a form he gave me to talk about my condition, or what he was concerned about, or what he wasn't concerned about. And this is what he gives patients. And let me grab my glasses here. Not just me, because I have a background in healthcare. This is what he gives patients for them to walk out. And it's your biotin interface with immunoassay. And it goes on to explain what the lab tests are going to say. And there's a list of hundreds of assessments and what they might mean, but it just says, thyroid stimulating hormone, reflective, lab 840, potential impact of high dose biotin results is falsely decreased, and it has a line for everyone. Like I said, there's hundreds of these. So they're talking about C peptides and cortisol and estradiol and testosterone and alpha fetoproteins and cancer antigen 125, and it just goes on, and potential impact of high dose. This means nothing to me. He needs this to read my results. He needs to tell me, hey, we saw a couple things that are out of whack, and this is what they mean. Or we saw nothing out of whack, and that's what this means too. I need him to interpret it in the simplest terms. Giving more information doesn't help your case acceptance. It's a fact the worst. If I had to make an assessment on what to do next with my health based on this, I would do nothing. And that's what your patients do. They're getting overloaded with information. They need to know about it in layman terms. And even if they ask you, well, how would you do it? You still don't give them a dental education. You don't give them a dental step-by-step. You give them the big picture in layman terms. We're going to take that off. We're going to treat it. We're going to rebuild it. We're going to get you back to your bite. We're going to get you smiling again. They need those kind of words. So if you're having issues, that's just one step in a multi-step case acceptance. Like I said, if you're waiting till that last minute when you're sitting down and you have that paper in front of them, you missed the boat. So again, sign up for that masterclass training. If you are part of our normal subscribers and you get this training in your email, hey, you're going to get an email inviting you to it. Look on our Facebook page. We'll also have a sign up there. And again, we're coming up really soon. It's again motivation, and we're looking at the 1st of October. I think it's October 2nd is the first one, and we're going to have a few sessions on that. So keep your eyes out. I hope you haven't missed this. I hope you're not watching this in a replay somewhere, and you can sign up for it. So until next time, and we're going to talk about more case acceptance and getting your treatment plans accepted so you can get the care those people need. This is Ginger Bratzel signing off today. Bye-bye.